You are the chair of Department of Medical Imaging, Tamati Faculty of Medicine, and you're also the editor-in-chief of the Canadian Association of the Radiologists Journal.
After 20 plus years, when I come back to UHN, I see stuff which I didn't see.
In the next 5 years or 10 years or 20 years or 50 years, like where do you think the evolution is going to be?
Here's a question. What would be happen from medical legal point of view if you disagree with I?
When we start talking about academic radiology, how did you get interested or enticed by academic radiology? At what point of time in your career you knew that this is the path that you wanted to pursue?
Sure. Good morning, Satish. Thank you for inviting me, and thank you for this excellent first question. I tell you first, I'm coming from a family of academic physicians. My grandparents and parents are academic physicians, so it was kind of easy decision. But radiology, I was hooked when I was in medical school, was good, 35 years ago.
Yeah.
And
how did you get, because at that point of time, there wasn't all of this like fancy 3D, CT, MR, and all these latest technologies, right?
Yes, but, we already have ultrasound, CT, and MR first. I was in love with ultrasound because it's real time.
Okay.
You really see what happens. And as you know, your job as a medical student to arrange the tests.
Absolutely.
So you go and look, and also on CT, I was kind of part of the discussions for vet reads, and it was very interesting. And I decided it's what I like.
Mhm.
It's what I'm going to do. And, actually, not correct. I went in the wrong direction, sorry, for a short time. I went to residency OBGYN.
Really? Okay.
For reasons that I wanted to do obstetrical ultrasound.
Interesting. Because now, for the most part, the OBGYNs, they have taken over obstetric ultrasound, except in Toronto, where we have our own radiologists significantly contributing as well.
Correct. But you know what? At some stage in my first year, I decided I like radiology more, and I don't want to do only ultrasound. Actually, I want different modalities. So I went to radiology, and
absolutely. I mean, I'm assuming that's the best thing that could have happened to you. But for the field of radiology, I would say absolutely, without any doubt, that's the best thing that happened to us. Because in addition to all your accolades, you were awarded the gold medal from the Canadian Association of Radiologists for a very distinguished career. And the most interesting part about that is that you're not even past your prime. You're still in your prime, and you have so much more to contribute, and you've already been awarded this medal. So I think that it's a great boon to the radiology community that you chose radiology instead of OBGYN.
Thank you. I attended a award ceremony in one European society maybe 15 years ago. And when somebody very distinguished and quite senior was receiving the award, it told that awards is a part of old age as calcium in your vessels. So I do hope I still have not much calcium in my vessels. But it's definitely nice to be recognized.
It's amazing. So premature.
Yeah.
So, Michael, so now you were attracted to the academic side of things pretty young. But now when you have trainees or fellows or somebody coming and asking you, what is the fundamental difference between community versus academic? How do you approach that conversation?
Additional excellent question. And I do think I know both sides. In my prior chapter, when I was at McMaster, I used to do community radiology 1 or 2 days a week. So I understand both sides really well. And both are excellent. They're just different. When you're talking about academic side, you definitely get complex cases. And when you go to community sides, it's more straightforward, but you have very high volumes.
Okay.
And also you have to be a generalist, which doesn't exist anymore in academic centers. For example, when I worked in with outpatient centers owned by my prior group, you have to read everything. And everything, for example, I'm an abdominal radiologist, but here you have a child with equation fracture, and you have to read it. And of course, it's not easy, but I do think it's kind of win-win. For example, when academic radiologists work in community, and you get some specialty read, but it also gives you opportunity to do a little bit of everything. And you keep your skills. But in academic medicine, I think that advantage, you really see crazy cases. You see a lot of interesting stuff. And I can tell you, after 20 plus years, when I come back to UHN, I see stuff which I didn't see.
Absolutely.
Yeah.
We kind of keep learning new things every single day, as you point out. Like there are some new syndromes, new twists on an old thing. And that's every day. It's pretty interesting. So I think like the way you point out is that it's not just the academic work which is different, but even the clinical work is different between academic and community. So academic is more depth and community is more breadth. So you need to have more breadth of knowledge to work in a community center, whereas in academia, you need to have more depth of knowledge. And also that you point out that in academia, the cases are going to be complex, which is going to take a longer time. So you need to have more patience to dig into everything to come to an answer. Whereas community, you need to do more volumes. It's not necessarily a bad thing because we have a backlog of everything. We do so much imaging. So we need people to kind of be able to be accurate over a prolonged period of time and keep up the grind going as well. That's very interesting.
Yes, and I tell you, it's also changing. Used to be that community hospital didn't have a good equipment. Not anymore. We have multiple CTs and MRs. And there are very large groups here at Toronto area, which are larger than academic departments, actually. Not with specific department, which is the largest in Canada, but
absolutely.
And people do good work. Also, these days, I do believe you cannot get a job in community, at least here at Toronto, if you have no fellowship. So people do good work. And I think it's very important also for us as educators. We predominantly train people to work in academic space. But 70% of people who are graduates will go and work in community.
Absolutely. Because the training occurs in academic centers. So we train them to work and think like academics. So I think that maybe a component of training as well should go to how things work in community, as you point out, like 70% do end up in these community hospitals.
Yes, I tell you, I think it's very positive. And we give opportunity to our residents to do some rotations in community. For reasons we have to see everything. We can't be only in ivory tower of academic radiology. We have to see both sides and decide what's good for them. What's the best fit? And, maybe related question. I do think it's very important to have part-time option, which was not available for a long time for reasons that many people have young families. And then if we want to keep them in academic radiology, we have to be more flexible and give people opportunities.
Absolutely. But one thing I wanted to ask is when you bring about trainees, when I speak to most trainees as to whether you want to do academic versus community, the first and almost the only thing they say is that, academic radiology means research. Because everywhere, academia is being equated to research. So this brings about two questions. One, does every resident need to be trained to do research, expected to research? And secondly, in an academic hospital, if you're a faculty there, are you expected to do research, every single one of them? And what are your takes on academia equals research?
Sure. I tell you, one size doesn't fit all. So first, I think that everybody should get a basic training in stats, for example.
Okay.
And then people have to decide. Of course, we want more papers, we want more grants in department. But I think that education is very important. And some people are extremely talented educators, and maybe we don't want to do as much research. And it's very important because we have to teach. We have to teach every day at workstation. We also have multiple teaching opportunities outside of the department. So I think that maybe education is undervalued. And there is a lot of discussion now at the level of dean and medical school how to support more and appreciate more educators. They can be promoted. It takes a little bit more time, but I think that education is very important. And also something between the scenes, I think that admin work is also important.
Absolutely.
It's very time consuming and sometimes can be not very pleasant, but somebody has to do it. And, different people have different skills. Some people are multi-talented. They can do everything, but some people have particular strengths in education or admin work. So I don't think that, again, we definitely want researchers. But what I can disclose? When I was interviewed for the job, they asked me what's the most important as I see it. And I was told them that more important than grants and papers are to attract good people and also to retain good people. Because if we put so much pressure on specific people, we wear them out and then we leave. So I think people are most important. And again, opportunities to use their different skills.
Interesting. So I understand that is part of the problem that research and grants have a good metric of measurement. The amount of dollar figure of the grant, the number of papers, the impact factor of the paper, the number of citations. Whereas when you take education or admin, there aren't very good metrics of measurement. And I do understand that for education, there might be, oh, did you bring about a new education or innovation project, which is good. But still, some people do the previously established stuff really, really well. So, for example, there is an established CT colon course, and some people do a really, really good job of that. Teaching residents at the bedside, some people do an amazing job of that. And often, as you point out, that as well as the admin grind work, it feels like it's not being recognized enough because it's already a pre-established route. Whereas the other aspects of admin and education, if you actually create something new, then it may be recognized, but otherwise it just defaults to research. And is the problem always how to measure it?
Yes, you know what? It's much well established metrics with research, but you have to try to elevate people. I think one of the really good internal metrics is people who get awards for teaching. And as you know, we have awards from residency program and for fellowship program. Yeah. And some people in our department, superstars, we get over 10 awards. So it's really we doing something right. And, I'm very proud that we have quite a few people who have been promoted to full professor based on their teaching. That's just amazing. Because they contribute significantly more than average person. And some people are just very talented in teaching. Admin, not simple. Yes, no good metrics. You know what? It's a good question of leadership. How you measure leadership. Totally. If everybody loves you, are you a good leader or maybe you're doing something wrong?
You have a lot of these trainees and a lot of faculty who now look up to you for not just like support and help, but also to be actively sponsored and to be mentored by you. And I'm assuming that your life was also shaped by the mentors that you had in different stages of your career. Like during these navigational periods in which you took up the position of the chair, you took up the position of the editor-in-chief, do you still keep in touch with your mentors? What advice have they given you over the years? And then does that also shape how you act as a mentor to the trainees?
Oh, yes. You know what? Many people talking about mentorship. What I do believe, you have actively look for mentors in your early career and very important in mid-career. Some people reach, I would say, plateau when we go to associate professor level and decide we're done. Everything is good. You really have to try to connect with people. And, when I started at Hamilton, at my department, at my site, I was unable to connect with somebody. So I went to different site and started to work with shared Dr. Sad Somers at the time. And it was very rewarding. He opened many doors for me. He introduced me to people who are very established GI radiologist. At time was abdomen was equal GI. And it was really, really helpful. Another mentor, when I came to this department in 2002, I came actually to do scientific work with Dr. Stephanie Wilson. What I know about her, I had a Wilson book. And when I didn't know something on call, I would open the book. So I had, I would say, temerity to write Dr. Wilson and say, can I come and learn from you? And she told me, yes, please come. Yes. And it was amazing. I was only one fellow in my year, which was full of bright people who did 3 months with Dr. Wilson, because it's very demanding. Absolutely. I was coming at 7 o'clock, she was there. I was leaving at 8, she was still in the department. But it was excellent training. I'm very proud that you go to ultrasound at TGH. You will see my posters with Dr. Wilson on the wall.
Yes, they're still there. Yes, yeah, we're still not taking them down. It's kind of almost like we knew you're going to come back.
Well, I don't know, but it was a fantastic opportunity. I do think, what, you have to learn from the stars. Maybe more difficult, but you really have to go to the best people. And I think it's very important when you go fellowship to do some research and see. Of course, you have to talk with people and see how fellows are happy, but it's important to go to the stars. And, I'm trying to pay it forward. I'm very open and I'm trying to help people, not only in the department, given my position. Many people come from across Canada with good ideas and I'm trying to help them. And it's fun. It's always two-way street. So you not only teach people, they come with bright ideas and you learn more from this conversations, with interactions, and some of them becoming kind of lifelong friends and colleagues. I'm very proud. When I started to be an editor 6 years ago, we started mentorship programs journal when we pair residents with very senior radiologists, usually with editorial board members, and we work for. So when I'm talking about it, we also have awards for best reviewers. So 3 of our former editors in training got this award last year. It means that people stay with us, and we really high level colleagues these days.
That's amazing. Like when you talk about the two-way street, the thing I remember is that he's saying that the treasure are the connections that we make along the way. And I think that one thing I took from what you're saying is that we often say that, oh, there's not enough mentorship or people should do this more. But I guess that, as you point out, part of the responsibility is also on the mentee, because as much as we would like it to be there, mentors are not going to actively come and search and find you to mentor you. You need to kind of put in the work as well. You need to have incredible work ethic, but in addition, you need to put in the work to find mentors who suit you as well. And then when you kind of reach out, the mentors are quite happy to take you under their wing and show you the ropes.
Absolutely. And I tell you, you have to be very proactive. For example, what I did and what I think people, you have to go to conferences and approach people. People are generally nice.
Yeah.
And you definitely will find people to collaborate, but you have to be there. I think it's very important to start to go to conferences at a young age. And ideally, you should present something because it gives you additional visibility and opportunity. I always tell residents first, when you go career meeting, you rub shoulders with your potential employers, which is not insignificant. Second, you really have to be seen.
Yes.
And also in the major international conference, you have to approach people. And some people would say, I'm overextended, but some people will say yes.
Yeah, you never know what might happen. And you point out, like, that's a good way to make a first impression. Rather than going and meeting people, you're already publishing something, you already have presenting something in a conference, and that's a good way to make a first impression to all these new people. But picking that on that line of thread, so you did point out that residents should have a basic understanding of statistics. But now we're in the age of AI, and we've been talking about AI for the last 5 years. But still, it seems that the hype train keeps going on, and there are new things being coming up every day as we see it. Do you think that in addition to statistics, people should also have like a reasonably good understanding of AI, if not coding, but at least like some very strong understanding of AI, because that seems to be the direction in which things are going?
Yes, no, I absolutely agree with you. First, we're lucky many of our residents have a strong engineering background. Which is definitely a major asset for radiology, for medical imaging. Second, yes. And, university was around for 200 years, and University of Toronto is very interested in AI. So there are multiple courses available. We have some stuff in-house, and also there are university courses. And, for example, there are some people who do masters in addition to residency or fellowship, but it's definitely not an expectation. There is a wide range of opportunities, but at least some basics are very helpful. And, we're talking about the people who are on their 20s now, we're going to live 90 years, and probably, unfortunately, the career would be at least 50 years. So I think it's very important. I think it's very important and definitely help people in their academic career.
What are your thoughts on this? Because I wanted to ask you about this. Back in the day, we always used to say we worked in reading rooms. Clinicians used to come down. We used to have these discussions. Now, more and more, as you point out, we have these isolated offices. We're either working from home. A lot of meetings which used to take place, for example, the departmental meeting we had this morning used to be in person. Most of them are going online and in Zoom. And those are great for efficiency. People are able to participate. The efficiency of online and remote work has been proven. However, when it is coming to creative ideas, or at least for myself, some of the ideas which I had for my studies for some improvement project which I did was all randomly walking through corridors, chatting with a technologist here and there. And then they said something and it just sparked an idea. And now that we don't have opportunity for that anymore, how, as a leader, how do you make sure you reach out to all people in the department to get to know everybody, bring people together? Because isn't that one of the biggest challenges of the current day?
Absolutely. In addition to fundraising dinner, what we also have faculty appreciation night, which usually late October or early November. And I think that people like it. It's always well attended. Mm-hmm. And it also gives opportunity to people to mingle, chat, have discussions. Problem is time, of course. Mm-hmm. Yeah. There is definitely issue of traffic in Toronto, and it's not easy to bring people in. I tell you myself, I'm trying to visit groups and talk with people. I thought that Zoom is absolutely great, but you still sometimes have to have face-to-face and chat with people. And, sometimes you have disagreement and kind of heated discussions, part of normal life. I think it's more respectful when we do it face-to-face and not...
Totally agree, because you at least understand what the other person is coming, and quite a lot of times that creates new ideas, which both of you can then work on. You do an experiment and try and solve it.
Yeah. So I don't know what's an answer of this question. It's always a compromise.
Yes.
You're trying to, and again, you have to be respectful of people's time. And time to commute is just not the best part of your day. It takes time, and we all have clinical responsibility, which growing all the time. I'm looking on multidisciplinary rounds today, and 20 years ago, it's totally different. Number of rounds, for example, but it's same people, and clinical volume definitely different when it was 20 years ago.
Yeah, a lot has changed in the last 20 years. But what do you think is going to change in terms of academic radiology in the next 5 years or 10 years or 20 years or 50 years? Like, where do you think the evolution is going to be? Because something like I was talking to one of my colleagues the other day, I'm not sure if you have looked into this, like many of these, like the large language models, ChatGPT and all that stuff, they now have a mode called deep research. And if you put in a radiology question, it digs into scientific research and gives you a beautiful answer, almost like a review article, which kind of means that in the current day and age, review articles are no longer needed because ChatGPT is able to generate them. Similarly, do you think in terms of academic radiology overall, anything is going to change in the foreseeable future?
Yes, it's always tough to make predictions. And we're almost always wrong, but
we did predict like that. I do believe radiologists will not be trained in 5 years, and here we are 10 years down the line.
First, let me address it because it's really interesting. If you look on vendors, on large language models, or let's say any AI model, if you ask him, can you function without a radiologist? Tell you no. Are you taking medical legal responsibility? They no, we always have radiologists as part of the system. And I don't think it's going to change because from insurance point of view, no model or kind of whoever creates a model would be willing to take this risk. So we're going to be part of it. But we definitely have to embrace what's going on. And I see a lot of potential for integration with models. I think that low-hanging fruit, which probably also going to be less controversial, is everything related to workflow, how to optimize our workflow. It's unfortunately we have a still long waiting lists, and every day we have empty spots, people cancel last minute. So here AI definitely can help. And now also I do believe that issue of requisitions, this kind of stuff, AI can help to help us get more clinical information, which is critical.
Yep.
And as you know, it takes us, we have to be, detectives or investigators to get all the information we need. It's not only abdominal pain, it's slightly little bit more. You need to make an intelligent report and differential diagnosis. Now, the tough question you will ask me, what would happen when AI reads the scan? And I think I don't expect it's going to be AI alone. It's too big responsibility. It also can help. I know there are multiple models that will look and find the pathology and tell you, you have, 20 CT on the list, you have to read this one first because it's abnormal. But here's the question. What would happen from medical legal point of view, if you disagree with AI, should you disclose it to patient? I tell you, I just had been in large conference in Europe months ago in ECR, and their departments, I understand, bought multiple algorithms, and we're struggling with this question. What would you do? Again, if you think it's wrong, and I say it's right. And what you're going to do, are you going to keep with interpretation? Are you going to disclose to referring physician? Are you going to disclose to the patient? I think that a lot of stuff is still we're finding our way. And it requires a lot of collaboration with people outside of radiology, outside of medicine, people in legal field, for example.
That's very interesting. I never thought about that. But speaking about like AI in academia, because you're the editor of CRJ as well, what are your thoughts about people using large language models to write papers? Now, people do it in different ways. Some people LLMs write the entire paper, but at least like people for whom English is not a first language, if they come up with a draft and then used AI to fix the spelling errors, fix the grammatical errors, improve the flow, do you think that's okay, or still we need to ensure that we're writing the papers ourselves?
Yes, I tell you, it is a tough one, and it's really a work in progress. First, I don't think it's okay for AI to write the paper, but I'm totally fine with AI helping people with grammar and spelling. And, we definitely want to be inclusive. There is a big disadvantage for people coming not from English-speaking countries, because when you see paper who is not well written, you're kind of less excited to accept it. And some journals actually have people on staff, medical writers, if you wish, who edit with papers. So I do see a role for large language models, but not in completely writing the papers.
Michael, it's been a pleasure. But before you leave, one last question. What advice would you give to trainees, radiologists in their early career, maybe even mid-career, or primarily like trainees, residents, and fellows who are looking into jumping into academic radiology but still have their doubts? What advice have you got in your life regarding that, or what advice would you like to give to those trainees?
I'm not done yet myself, but if we're talking, I think it's what we talked before, mentorship is very important, and networks. I do believe a lot in multi-sites, multi-center, multi-country collaboration. So I think people really have to network, get more friends who become collaborators, and it's important. And also actively look for mentors. Somebody still, despite AI and everything, should open the door for you to ivory tower. So I think it's important really to look for mentors. And I think it's still important to read a lot of stuff. You would never get good ideas if you don't know what happens in radiology, what's hot, what's already done. Because let's say you have an idea, you wrote a paper, and it was journal already published 5 on this topic in the last 2 years. So it's not exactly. So I think it takes a lot of time. And with all the gadgets we have, it's definitely help you to know what's going on. Some journals, do digests of what they publish. So, but you still have to read.
That is amazing. Thank you very much, Michael. So with all AI and everything that can significantly improve efficiency, but at the end of the day, the heart of it all, if you want to create something new, if you want any innovation, the key is networking. So reach out to mentors, reach out to people. And this is our way of reaching out to all of your audience out there. So reach out, form your own networks, and create something awesome. Michael, it's been a pleasure having you here.
Thank you, Satish. It's always a pleasure.